Today, we're looking at a company with a massive, and I mean massive, ambition to fix American healthcare. But its mission is walking this incredibly thin tightrope between a huge breakthrough and a total breakdown. And that really gets to the heart of it, doesn't it? The stakes here are just so high, and not just for the company, but for all the patients and doctors who are caught in the very system that P3 is trying to change. So where are we getting all this? Well, it's straight from the horse's mouth. We are diving deep into the official 2025 annual report. That's the Form 10-K that P3 Health Partners filed with the U.S. government. This is their story, in their own words. All right, so first things first, let's unpack the promise. What is the big, hairy problem that P3 says it was created to solve? Well, according to P3's own report, the U.S. healthcare system is fundamentally broken. Costs are just out of control, hitting over $5 trillion. The old fee-for-service model, right? It rewards doctors for doing more stuff, more tests, more procedures, not for actually making people healthier. And this is leading to massive burnout and making it almost impossible for independent primary care docs to keep their doors open. So P3's big answer to all this is something called value-based care. The core idea here is to completely flip the script. Instead of paying per service, doctors get rewarded for how healthy their patients are. Better health means lower costs, and everyone shares in the savings. At least that's the theory. Okay, so that's the big idea, but how do they actually do it? Let's break down their specific game plan. So instead of going out and buying up a bunch of doctors' offices, P3 partners with them. They let local doctors stay independent, but they give them this powerful toolkit. We're talking tech, data analytics, support staff, the whole shebang. And here's the kicker. They align the incentives. When the practice helps keep patients healthier and out of the hospital, both the doctor and P3 get to share in the money that's saved. And you know what? It really seems like the doctors are buying in. P3 reported a physician retention rate of over 88% last year. That is a huge number, and it tells you that doctors who join this model really want to stick with it. So far, this story sounds like an absolute home run. But, and this is a big but, this is where the story takes a really sharp and dramatic turn. Because buried inside that exact same annual report is a very, very different diagnosis, one about P3's own financial health. Which leads us to the big one, the massive financial red flag waving in this report. This sentence right here, this is probably the single most alarming thing you can ever find in a company's financial report. It's a direct quote from P3's own management, and it's a formal warning that they might not actually survive. So what does a going concern warning even mean? Well, let me put it this way. This isn't just a bad quarter. This is the company's own leadership, their own management, officially stating that there is substantial doubt they'll have enough cash to stay in business for the next 12 months. It is the financial equivalent of a 5-alarm fire. And here are the numbers that explain why. In 2025 alone, P3 lost over $323 million. I mean, that is just a staggering amount of money to be losing when you're trying to prove your model is sustainable. But it actually gets worse. That one-year loss is just part of a much, much bigger whole. The company's total accumulated deficit, that's all the losses piled up over its entire history, has now ballooned to more than $650 million. And that going concern warning? It's not some isolated problem. The report goes on to outline a whole mountain of other risks that the company is facing. Okay, so look at this chart. This is what you call putting all your eggs in one basket. A massive 75% of P3's entire revenue comes from just 4 big customers. If they lost even one of those contracts, it would be absolutely devastating. And on top of that, the report just lists this cascade of other major issues. They say they urgently need to raise more money just to keep the lights on. They're facing fierce competition. They've failed to meet key financial rules in California. And, get this, they're at risk of being kicked off the NASDAQ stock market entirely. So, where does this leave us? You've got this incredibly noble mission on one side and what looks like a financial train wreck on the other. You know, the company's own motto really sums up the whole conflict. It's people, passion, purpose. And it's inspiring, right? You can feel it. But this report forces us to ask a really tough question. Without profits, or at least a clear path to get there, how long can that purpose actually survive? And that, I think, is the real takeaway here. Is P3's financial crisis a sign that their specific business model just doesn't work? Or Is this what it looks like when you try to fix a multi-trillion-dollar, deeply entrenched system? Is this just the incredibly high cost of trying to do something that big? That's the question worth chewing on.